Finally, I want to welcome all the members of the audience who are with us tonight and those who took the time to submit questions here for our conversation on healthcare. Thank you for joining us for the program tonight. With that, I would like to begin by asking the first question of Congressman Ryan. Now that Congress is back in session, and last Wednesday the President made it clear that he favors the public option, but is not necessarily married to that as something that has to be in the final reform, healthcare reform bill. What do you think the chances are that we're going to see some kind of healthcare this year?
Well, nothing's 100%, but I think, if I had to give it a percent, I'd say probably 90%. I really, really believe that this is the time something's going to happen. And some people are critical of the fact that it's taking too long. Some people are critical of the fact that we're jamming it down their throats, and there's points all in between. But I think this is really the year. We have a president who still has some popularity. His popularity went up after the speech on Wednesday night. And I think why it's going to happen is because average people who are living in the United States of America know it needs to happen. Knows that these chances don't come around all that often. And so I think people feel it. They feel it in their wallet. Small business people feel it. Big business people feel it. Everybody is feeling the squeeze. So I think there's a really, really good shot it happens, and it'll probably happen, in the next couple of months.
Has President Obama staked his presidency on this single issue?
Well, I think to a certain extent he has. I mean, it'll be a much different presidency if he passes it, and it'll be a much different presidency if he doesn't pass it. So I think to a certain extent he said, I'm all in.
Congressman, thanks for joining us tonight. Our first questioner tonight is Leonard Christ. Leonard, if you would go to the microphone. Leonard is a student from Youngstown. We'd like to see true universal health care, not mandated health care, where everybody must purchase a policy. Leonard, your question, please.
Barack Obama came into the White House with a larger majority than President Bush had. There's supermajorities in both houses of Congress. Why not just push it through? They didn't really have these kind of town halls for, like, say, the Patriot Act or the Iraq War they did, but not the Patriot Act. So,
well, unlike the Patriot Act, or so we think, healthcare is something that touches everybody's life, and I don't think healthcare is something that you can just jam through. And as difficult as these conversations are, they all touch people, and they all touch people in different ways. So you're a student, you have one opinion. I mean, I was at the Canfield Fair for 4 or 5 hours. I got 150 or 200 different opinions on what we need to do for healthcare, because you're on Medicaid or you're on Medicare or you have a certain policy. So it's so different and it's so personal that I think it's something that needs to be discussed and worked through. We got to do this thing right, because at the end of the day, I think politically, people would be hurt if we jam something down their throats and then people don't like it. So we have to take our time with this. This is not tax cuts where you can say everyone's getting a tax cut. The worst case scenario is you're going to get $300 back. This is going to affect people in their day-to-day life, especially if they have some kind of tragedy in their life. So I think it's very, very personal, and that's why it's going to take a little time. And they say, making legislation is like making sausage. You don't want to watch the process.
Leonard, any follow-up?
No.
Okay.
Thanks,
Leonard,
Leonard.
thank you for your question. Sandra Martin. Sandra, would you go to the microphone, please? Sandra is a student in social work, works in social work at Youngstown State University. And Sandra says there are too many redundancies and inefficiencies in the current healthcare system that we need centralized and computerized records that maintain a patient's privacy. Sandra, your question, please.
Congressman, my original question was, whenever I try to discuss the Obama policy, and with my fellow classmates and with the everyday citizen, there's a lot of misinformation out there exactly how we can save the money that I spoke of before. But could you tell us where we could find a good, reliable, easy to understand source of information instead of so much misinformation for the public?
Well, I've been recommending to people just in general that if you watch MSNBC, and that's what you watch CNN all the time, that you take a week out of your life and you watch Fox News. And if you watch Fox News every single hour of every single day, then you need to take a week out of your life and watch either CNN or MSNBC or some alternative. Because each side is saying something different. And the people that know most that I've just been interacting with, especially over the August break, have been people who watch all of these different TV programs because they kind of take all of the information and then they come to their own conclusion. They may be inclined to believe something or the other. But you can go right on to the Thomas website, which is the Library of Congress, and actually get the bill and read it. And people have had all kinds of questions, and they said, have you read the bill? I said, yes, I've read the bill. You can read the bill too, and go to this website and check it out. But all the information is there. You know, the Democratic leadership has an outline of the bill. The Republican leadership has critiques of the bill. And I'd say, I mean, you got to spend some time because it's very complicated. But you can go to these leadership websites, and probably the president probably has one too. There's a lot of information on our website that you can access as well. But I would say if you're not inclined to get on the internet and spend hours of your life trying to really understand this, I would just try to switch up which kind of media you're getting, which radio stations, what TV stations, and you'll get a good cross-section.
Thank you.
Information is a good thing. The more sources you check, the more informed you're going to be.
Yeah, and there's one, the St. Petersburg, I think it's the St. Petersburg newspaper. They have a Pulitzer Prize-winning fact check kind of process that they go through where you hear all these stories about what healthcare has in it or does not have in it, and they fact check it. And there's different kind of fact check internet sites too that you can go to, and I think those are very helpful because they'll outline and they have rating systems as to this is a whopper of a lie, or this is true. One of the ratings is pants on fire, that the lie is so bad. So they have all kinds of rating systems, but they're very helpful.
Do you use those?
I try. Yeah.
Thank you. Tim Francisco. Is Tim with us? Yes. Close to the microphone. Good. Tim is a professor from Poland. He thinks the current system is neither efficient nor fair. He supports tort reform and the public option. Tim, your question, please.
Yes, Congressman. As was mentioned at the beginning of the broadcast, the public option is now on the compromise table, and it likely will go. That was billed as one of the means of actually keeping costs down at the top, as opposed to increasing the number of insured at the bottom, for lack of a better word. How do we intend to keep those costs down without a public option, and will you vote for a bill without a public option?
I am supportive of the public option. I think it's important to have in there, but it's not a deal breaker for me because I think there are so many other good things in the bill that will be helpful. And I think a public option would help control costs. One of the points that I think no one's really been talking about is that if we have insurance reform, if we have, you can't be denied coverage because of a pre-existing condition. If we have, you will be capped at how much you can spend a year on your own health care. Now your policies are capped. We're saying it's going to be capped at how much you'll have to spend, but you'll still get coverage. If we put some of these reforms in and make it universal, make universal coverage where insurance companies have to cover people, there's something that's very significant that's going to happen. It will now become in the insurance company's interest to keep people healthy. So you will see a shift. Now the game is trying to keep people, if you have diabetes, they'll say, well, if you have diabetes, we're not going to cover you. Because we know what that leads to. That's, $6,000 or $7,000 a year. That may lead to amputations. We try to avoid having that in our portfolio. But now, if they have to cover you, all of a sudden their time, money, resources, energy, staff work is going to be spent on how do we keep these people healthy. And you'll see insurance companies, it will now be in their interest. It will be profitable. One gentleman, Michael Pollan, who writes a lot about the food we eat and sustainable agriculture and those kind of things, says an insurance company will see a chicken nugget on a kid's lunch tray and see $400,000 coming out of their bottom line one day. So this will dramatically shift what insurance companies and how insurance companies operate. And I think that's how you're going to see savings. You'll see insurance companies investing into physical ed programs, preventative programs, wellness programs. It'll be in their interest to do that. So although the public